Hi, I'm Hosanna Haddon, and I'm here with Alison McDonald of Newcastle Speech Pathology. Now today we're covering a very important topic. So I understand NSP likes to cover about a topic a fortnight with blogs and information posted. So what's the topic for this fortnight?
Well, recently we've been thinking about speech pathology and how it relates to supporting children with mental health concerns.
Yeah, that sounds really important. Is this something you've noticed more of a need for?
Oh, absolutely. So I've been a speech pathologist for 30 years now, and over the last number of years I've just noticed an increase in the number of clients who are having mental health issues, I guess, stress, anxiety. We've all been through COVID. There's been so many things that have triggered just a bit of a tsunami really in not only kids but adults as well, in I guess stressful responses to things that are happening in their lives.
Yeah, so important. So what is the link between speech therapy and mental health? Because it's not a link everyone would naturally make.
Yeah, absolutely. Well, have a little pause for a moment and just think about this. When you came here today, you were thinking about what you needed to leave the house. You were thinking about what you were doing with the day. You were planning out your day. You probably stopped to pause to think, oh, do I need to bring an umbrella? Do I need an extra jacket? What's the weather going to be like? Where am I going? Who am I seeing?
Yeah, it's true.
Do you know what? All of those thoughts you had, you actually used language. So you actually needed words, and you needed to be able to put them into some kind of coherent sentences to be able to take yourself through those logical thought processes.
Yeah, sort of like the narration in your head, thinking it through. That makes a lot of sense. I'd never thought of that before.
That's right. So we actually need language to think.
Yeah.
Now, there is a percentage of the population who think more in visuals rather than words, but on the whole, the majority of us actually use language. So we really need to have the strong language skills to be able to support the right self-talk, the right processing to be able to develop strong mental health.
Yeah. Well, they sound like very important skills. So would you have some tips for developing these skills?
Absolutely. So first of all, you need to have the words. So children need to have the vocabulary to talk about their mental health. They need to be able to talk about their emotions and feelings. But they also need to have what we call these cognitive verbs. So they're verbs or action words, things that we do with our brain, things that we can't see necessarily, but like thinking, reasoning and wondering and solving problems. It all happens up here. We can't show a picture of it, but they need to have the language and how to do that. So we've got to teach them the right words to use. And then I guess the second probably big tip is actually, as adults in a child's life, we are able to coach them and teach them how to process the information or how to tell their story, how to think. So you can do that by modelling it. So when you're going through your own thought processes in the day, speak them out aloud and just help children to understand some of the things that you're thinking about. Obviously, we're not going to be loading them up with stress or anxiety about things that you might be concerned about, but just teaching them to talk about how they're feeling, because you're talking about how you're feeling.
Yeah.
And it's good for them to see that you're not always thinking or feeling positive, happy, joyful thoughts, that there are times when you're concerned or times when you are perhaps a little bit stressed or feeling a little bit frustrated.
Yeah, because it's all natural, right?
Exactly.
Yeah.
So modelling the language and modelling those thought processes is really, really helpful.
Yeah, that's some really good tips. So if your child is, or you've got a kid in your life that's all over the communication, sort of won't stop talking, or they've got the communication down, they've got the pronunciation down, is there still a role for speech therapy there?
Yeah, absolutely. So one of the things we do as speech pathologists is help people with their storytelling. So we are uniquely positioned to be able to help people structure and tell a coherent, concise, logical story. Because that's how we relate to each other.
Yeah.
We relate by telling each other stories. You think about your time if you sit down and have a cup of coffee with a friend, for example. You're mostly talking in stories. You're relating things that you've seen, heard, done, experienced, retelling things that you've heard about. And you've used language for that and the format of stories. And you know how good you feel afterwards after having been able to unload some of those personal stories. So we work with adults and children to help them develop the storytelling skills so that they can better connect with others. So not just with a mental health care provider, but with friends and family and in community.
Yeah, because it's not just kids, it can be adults too.
Absolutely, we all need to know how to tell a good story.
So if I myself or like a kid in my life or we're looking for help in this area, what would be sort of the next steps?
So I would say absolutely get in touch with a speech pathologist and have a chat about what you're really looking for. So I guess there's a bit of a misnomer that you would only see a speech pathologist if you had a problem, if you had a real difficulty, but that's not always the case. We're here to help no matter what stage of the journey you're on. So even if you've got fairly strong skills and you want to enhance those, we can still be, be able to provide some extra tips and advice in that scenario. So contact a speech pathologist, have a chat, and work out what the next step is for you.
Yes, those sound like some really good next steps. So obviously you're based here in Newcastle. What if you weren't based in Newcastle, you were somewhere else in the world or Australia? What would you recommend then?
Oh, look, yeah, of course, get in touch with a speech pathologist near you, but here in Newcastle we actually offer telehealth, and so we actually have clients who are all around Australia.
Oh,
and
wow.
we have the privilege of working with some really diverse people.
Yeah. Oh, that's very cool. Well, if you're looking for some more information, you can head to our website and learn about this topic. We've got a blog post up there on it, and we post our fortnightly topics for discussion and learning. So thanks for listening.